Hi there. Welcome to The Preventable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to another episode of In the Weeds, where we are digging in and getting to all things cannabis because it's complicated, y'all. So it is very nuanced, very complicated. We're going to talk about some more coalition work, what's happening with one of our the coalitions that Prevent+Ed helps support. But then we're also going to kind of dig into some law enforcement, like how they've been impacted with the legalization. And I'm sure you are leaning in because you know this is going to be a good conversation. Again, as always, thanks to Harvard Radio for giving us the space. We could not do what we do without them, so we are so appreciative. With me today is Melody Quinn. She's here sort of wearing two hats in a way. You are the director of the Crush Coalition. We'll talk more about what that means in a minute. But then you're also the Opioid Prevention Initiative Detective for the St. Louis County Police Department.
Correct.
And you call yourself Opie for short.
It's just easier.
Okay, so Melody, so forget about all the titles, but basically you're all things opioid. Is that right?
Yes. When it comes to educating, helping to prevent, getting people in touch with treatment and resources if they need it, we go out in the streets. Basically, I do anything that is needed if it is related not just to opioids,
Right.
Although that is where my, skill and expertise lies, but in all drugs. People with substance use disorder, you can't, especially in St. Louis, you can't separate opioids from stimulants or anything else. They're often
Connected.
combined. Yeah.
That's right. And you were telling me before we started recording that you've been doing this for a long time.
Well, I've been in law enforcement. This October will be my 17th anniversary. I've been doing this specifically since January of 2019. So
can you talk a little bit about the evolution? Like because it's kind of a big deal for a police department to be devoting time and people power to opioids. Could you talk just a smidge about kind of where Crush came and where the need for a specific detective in charge of this came from?
Sure. So actually, St. Louis Crush was originally just Crush.
Yes.
And it was begun in 2011 between the St. Louis County Police Department and the St. Louis County Department of Public Health. It was a collaboration. They realized that heroin at the time was a main driver. It was the deaths were increasing rapidly, and they wanted to do something to make a difference. I'm not sure they knew exactly how it was going to make a difference.
Right.
I'm not sure they
Did
were
any
really
of us
educated in the coalition world even.
Mm-hmm.
It was a step in the right direction because they recognized you can't do the same thing and expect different results. So it was really forward thinking on the county's part. And I got to be honest, St. Louis County is very forward thinking in a lot of the things that they do. As far as I know, and I have now had the blessing to speak on what I do in Los Angeles and in Washington, D.C., and everywhere in between. I am one of the few that are truly just dedicated to this work. I've never met another police officer that does exactly what I do, which makes St. Louis County and Missouri different.
Mm-hmm.
We are different. There are some things that we are behind on.
Of course.
But I don't think that has anything to do with the efforts that St. Louis County is trying to do to forward the betterment of our community. I think they're very, very tuned into that.
Mm-hmm.
So they realized there was a need, and they tried to get it up and running in around 2014, and take that with a grain of salt because it could have been a little bit earlier, a little bit later, in collaboration with the high-intensity drug trafficking areas, HIDA, which is a federal agency that helps to fund our drug enforcement program. They decided that they needed a heroin prevention initiative started. And so Crush kind of became in tandem with that, at the time, heroin prevention. And Crush was trying to get their feet underneath them through some things that happened that were really outside of the coalition's control. It kind of went a little defunct. And the heroin prevention initiative was kind of like, the way it seemed to me, a little bit like a DARE program, kind of bolstered a little bit with a little bit more education, a little bit less identification. And it was going pretty well. And then when I got the position and I learned about Crush, my background is in psychology. And there is substance use disorder in the past of my family. And so I felt really connected to the coalition, and I recognized this was the driver for the work that needed to be done. And of course, by the time I came on, it was 2019, and heroin really wasn't the driver anymore.
Right.
Fentanyl had taken the driver's seat. Heroin was in the back seat. I'm not even sure I would put heroin in the trunk anymore.
Right.
I mean, you might see it on the road, but it's not going to be anywhere on the ride.
Maybe on the luggage rack.
Right. And so we kind of switched it up.
Yep.
And we started really focusing on what Crush could do grassroots, because that's really what it is. And by 2022, I had been able to make it a 501c3.
Yeah.
Which really, again, changed course for us.
Yep.
And we've been really, I would like to say, at the forefront of making grassroots efforts into changing
I think you can say that.
Yeah, changing the landscape of St. Louis Metro. I mean, it's not just county, it's St. Louis City. And, you know, in my efforts, I get to go beyond just St. Louis City and county.
Because it's not like drug use stops at a county line.
No.
You know, and most people, if we're being honest, don't even know where the county lines are. They don't know when they're coming into one and going into the other. I mean, and they're certainly not like, oh, well, I can't use drugs outside of my county, or, you know, I mean, that's just silly.
Well, and people, unfortunately, will go where the drugs are prominent and cheaper.
Right.
And for a lot of people, that is driving into St. Louis from wherever they live nearby.
Right.
Be it Franklin County, Jefferson County, the Illinois side.
Well, and one thing that I don't think people really understand, I mean, I know I did not, is that when you're looking at overdose rates, the rates are calculated or based off of where the person dies, not where they live.
Correct.
So there are some, and I know that this sounds morbid to people listening, but this is really how it's done. Like, you're looking at coroner's records. And so there are certain pockets of cities, not just St. Louis, where it seems like that there are more deaths, and people say, and we saw this with meth too, right? Where it's like, oh, that's the meth capital of the world, or, oh, they've got a real opioid problem. Well, there are people selling it, and there's a gathering of people using it, but that doesn't even necessarily mean, oh, St. Louis County has a drug problem. Because, again, to your point, you have people coming in from all places to maybe get the supply, or maybe this is where one particular house is that is a, you know, place where people are using, or this is where, you know, like, so in other words, I don't think the average person understands how deaths are attributed.
Right.
Yeah. And so one of the things that you do at Crush is, like, you're looking at some of those areas where there are high overdose rates, a lot of times along interstates and places like that, and you're trying to go in to really say, like, what does this community need? And maybe you're providing resources in different languages. Like, specifically, I'm thinking about the work you've done in the Bosnian community, or the work you've done with Spanish-speaking folks. Like, could you talk a little bit about making the resources accessible to people?
Yeah, well, I think people forget what a mix of cultures and languages that we have in St. Louis. We are vast in the mix, and I love the mix. I think that makes St. Louis really special. And we have a very large Bosnian community, and so when I first took on this position, my very first conference was opioids in the workforce with UMSL.
Yep.
And it was at UMSL, and I was just...
I was there.
So,
yes.
Yeah, I was soaking it all in. It was so much great information. And that was the day that Yana was actually born, because I realized we needed to fill the gaps. There were so many gaps that were being explained, but there weren't any places to fill those. Understanding,
And what is Yana for people who don't know?
Yana is You're Not Alone. It's a fest that we have every year. We have now done 3. We were going to start in 2020. April 22nd of 2020 was going to be our first one. And then in March, right on my birthday, actually, everything was canceled. Thank you, COVID. But we had the dream that the idea was there. We just needed to wait.
Yeah.
But during that conference, listening to what everybody was saying and hearing some of the ideas, I was like, we really need to start talking to people in their language, in their cultures.
Yeah.
And there was the Bosnian Opioid Project that was created.
They have been on the podcast. Love that. Yeah.
And I have a heart for that project. I was so blessed to be able to work with them in the very beginning and really get out there and make things happen in the Bosnian community, because whether people recognize it or not, we don't correctly identify people based off their cultures, based off their languages. It's not as simple as white, black, or other.
Yeah. There's a lot of stuff in between. There's a lot of folks in between that we are leaving out.
Exactly. And we can do better, and I think we will do better. It's a slow process. Anything that's worth changing is going to be worth fighting for. But the idea was, let's start just doing things in others' languages. So we worked with Prevent+Ed, which at the time was the NCADA.
Yes.
And we had the website translated into Bosnian.
Yes.
We had the I can't remember the name of the campaign, but it was the talking points for parents and their children.
Talk about it.
Yeah, talk about a campaign. We had that translated into Bosnian, and then we did an actual marketing campaign in Bosnian.
Yes, that was so cool. The
was
bus stop
so
ads
cool.
and all that was awesome.
And being able to do the photo shoots and just be a part of all that and be a part of writing up the campaign was actually very, very exciting. My master's is in business, so it was kind of like a marriage of my two, ideas, my two brains.
Right.
And it was very exciting to see that take hold and to hear people's responses to the billboards.
Yes.
In another language.
That's right.
They hadn't seen that.
That's right.
And so it was something to be proud of. I have a picture of it still on my desk. And so once that was going and we'd gotten into the mosques and we'd educated in their language on Narcan and substance use disorder, and then they began creating their own coalition, which was the whole idea.
That's the idea.
Give them the information and let them run with it
Right.
In their own culturally appropriate way, which was another cool thing. We got to go into their mosques and I was very, very proud of myself because I practiced really hard on doing the appropriate headdress.
Oh, all right.
And I was mistaken as being Bosnian. And people were coming up to me and speaking to me in their language. And I was like, I don't know what you're saying. And someone was like, wow, you did a really great job. And so I felt really proud to be able, and not only to be welcomed.
Yeah.
There's such a welcoming community. But to be able to be a part, I really felt a part of their community, and it was special. That was a very, very special year getting to do that work with them.
Well, and you're really a person, and everyone, that's part of Crush. I'm thinking of all of the folks who man the tables and go to the events and everything. Everyone who's part of the Crush Coalition understands that you need to be scrappy. You need to meet people where they are. And I think that it's you need to evolve and innovate. And so that's really why you're here today, honestly, is because that's what we've all had to do as cannabis is, first of all, as we've gone from prescription pills to heroin to fentanyl to now xylazine and everything else synthetic, really having to adapt. But then also like thinking about what it looks like now that cannabis is legalized for adults. How do we keep it out of the hands of kids? How do we make sure that adults know the rules? Because there are some.
Right.
And that's important because we want to keep them out of jail. Like, I know that's your goal at the end of the day, right? So I'm wondering if you could talk about kind of the evolution where we're at now when it comes to like what is Crush doing? How are you sprinkling in sort of elements of cannabis?
Sure. Well, it's confusing.
Right?
I'll say that first and foremost, especially for kids.
Totally.
I feel so bad for kids in this day and age because, let's just put it out there. First, it was completely illegal. Couldn't even do research on it. Just, it was illegal.
Yeah.
And then it's medicinal. So now we're saying this is a medication. You can smoke a blunt and you're medicating yourself. That's a very different statement.
Correct.
Than this is completely illegal. So illegal we can't even do research on it.
Correct.
And then we're saying, well, it doesn't really matter what it is because now it's recreational. Anybody can use it that is, over the age of 21 or 21 and over.
In Missouri, by the way.
Right.
But if you go to Alabama, it ain't legal.
Right.
So where is it legal?
And then
why
federally,
is it?
it's still illegal.
Mm-hmm.
And that's another confusing thing. If you think about it from a law enforcement standpoint, you're not supposed to have laws that are less restrictive than the federal law. You can have them more restrictive, but not less. And this particular topic flies in the face of that,
right? Which
causes confusion, not just for children, obviously, but also adults and also for law enforcement.
Obviously. Can I tell you, Melody, the first day and we knew that this was going to happen, but to see it happen in real time was like pretty crazy. Like we knew that when Missouri passed medical, that we were going to have calls from everybody. Like, what does this mean? Employers, physicians, law enforcement, and we did. And we were doing our best to answer the questions because it was still, I don't know, like exactly, like here's what it says, but I don't know what that's going to mean. And so then we knew that once it was passed for adult use, that the floodgates were going to open yet again. And we don't know the answers.
Right.
And it's not like Missouri Department of Mental Health knows the answers because they don't. It's not like DHSS knows the answers because they don't. I mean, they might be collecting the revenue, but even they're still kind of trying to figure out all that. Like, no one knows the answers.
Well, we definitely put the cart before the horse.
A little bit. And I was in a school the day after it passed, in a high school, and there were kids wearing like tie-dye shirts, like, "Woo, it's gonna be 420 all the time, man." And I'm like, first of all, this did not pass for you. And second of all, we got a runway here. Like it's not just starting today. So hopefully you're not smoking weed today, my friend, because you're going to be in extra trouble. But it's like no one knew, and we quite frankly still don't really know. We're still trying to catch up.
It's hard. And a lot of people don't understand that when they voted for this, they weren't just voting for the ability. They literally voted for a constitutional right.
They changed
the Constitution for the state of Missouri.
So to change it again
is
to make it any more restrictive, less restrictive.
Hard.
Like it's going to be virtually impossible.
It will be nearly impossible. It is now a constitutional right in the state of Missouri to have cannabis.
Which we're not saying necessarily that it shouldn't be. We're just saying if you're even trying to put up more regulations or packaging restrictions or advertising restrictions or dosage things on the packaging, like, good luck having that written in. Good luck.
And if you think about it from a teenage point of view, when we were teenagers, who was like a big and cool guy? Joe Camel,
Yeah, right.
They used to have marketing for cigarettes. They used to have all this, like, you used to be able to drink on screen on commercials. You can't even do that anymore. There's been so many regulations over the years because they learned that these kind of marketing techniques work. I mean, there is a psychology to marketing, and people don't quite understand that, but true marketers understand the psychology, and they know how the human brain takes in information. And now we've regulated cigarettes. We've regulated alcohol.
We still have work to do on both of those. But, but there's no regulation on weed. I mean, cannabis, pot,
think about a little gummy bear.
Right.
Okay, a cannabis gummy bear. Technically speaking, I believe the last I read, a sixth of that gummy bear is actually a dose.
So like an arm of the little gummy bear.
How many people do you know are going to just eat a piece of a gummy bear? No one. I mean, an adult. But
No.
Children, if they come across, and I think we're seeing a lot of this, where children are seeing these gummy bears, sweet tart shaped things, sodas that have it in it, so many products, and these children don't know.
I mean, poisonings are going, whether it's
Way up.
accidental or intentional, and they might not be dying, but they're getting really sick,
Well,
They're
and that's the
getting
thing.
really sick.
I think because of the opioid overdose, people assume overdose means death. And it doesn't. Overdose literally means dosing over what your body can handle.
Mm-hmm.
So you can overdose on anything.
Yeah.
And you can overdose on cannabis. It is absolutely
you can
possible.
Get nauseous, you can get disoriented, we've seen that at schools.
Yep.
Where kiddos will bring maybe edibles to school and share with their friends, and next thing you know, they've got like 8 kids sick, like emergency room, and they're like, how did we get here?
Well, and the higher content of THC,
Correct.
the more likelihood that the negative effect will be psychosis. And we're seeing, research is already showing the higher number of psychosis cases, and even some of them that don't really ever go away.
Right.
And that's a scary find, because we are now acknowledging that the higher levels of THC have such an effect on the brain.
Especially the teen brain.
Well, and that's another thing. People don't understand that a child's brain and adult brain are entirely different. There is a reason that children and adults respond differently, because a child's brain is not fully developed. And another thing is that a child's brain has higher levels of THC receptors than adults do. So once the brain is fully formed as an adult, once the brain is a true adult,
it's cooked.
Brain.
Yes.
That's between the ages of 23 and 27. The average is 25. Their THC receptors just die. And we don't know why. I think they're still researching that. But children have so many more THC receptors, they're like sponges for cannabis. So if you're giving these high levels of THC, you're introducing a drug into a developing brain, you are creating these drug addiction pathways, you're creating problems. I mean, they've already started researching and recognizing that in pregnant women who use cannabis, that they're seeing higher levels of psychopathy in their babies as they reach adulthood. Mm-hmm. These things are scary finds. And because we weren't able to research for so long, we don't truly understand the fullness of what this is going to look like in 10, 20, 30 years.
And so what Crush is really doing is bringing this information to communities, to parent meetings, to churches, to law enforcement officers, to whatever, to really educate.
Yes.
I mean, it was on opioids, and you've evolved and innovated as the drug supply and as the demand changes.
Correct.
Right?
Well, you have to.
You have to.
And, there's been rumors out there that there's all this cannabis being laced with fentanyl.
Right.
And the rumor is that you're going to overdose.
Right.
Now, I can't speak for all situations, but Dr. Rodnick has educated me.
Yes.
Yep. Love Dr. Fred. Has educated me that, the molecular structures of THC and fentanyl do not operate at the same level. So,
AKA, that's not true.
Right.
We're busting some myths today, okay?
Right.
You're not going to get a joint and it's not going to have fentanyl. I mean, not
maybe
yet
it could,
anyway.
but it'd be
like
a waste.
right. That's just not how it works.
Right, because as soon as you light
right.
it up and you set it aflame, if you're setting it aflame like that on direct heat,
yeah, it like
the fentanyl molecule breaks down.
Right.
So
Thank
maybe
you for saying that. Yes.
So maybe it is laced with fentanyl, but you're not going to have the effects of fentanyl because that molecule will not hold up to that open flame. They just don't operate on the same level. But those are all things you've got to bring to the table,
to everyone, to people in uniform and people not,
because there's a lot of misinformation
correct
out there.
And I think, I mean, we don't have to go down this rabbit hole because I have another question I want to ask you, but I think something else you've been very helpful with overdose and fentanyl is the Crush Coalition has been helping folks in uniform of all types understand that you're not going to catch fentanyl, right? Like you're not going to like if you get too close, you're not going to be at risk for overdose. Like you and the Crush Coalition have really helped to dispel myths to help people intervene. And that's just because you're a person who is in law enforcement, being able to share that with other people, I think is just so incredibly helpful because you're a peer, right?
Yeah.
We talk so much about the power of peers. You can talk about that and it's amazing.
Yeah.
Can we switch gears for a second?
Sure.
Just to be clear, you're not supposed to drive while high, right? And do you drive like are people, since like it's now legal for adults, like is everybody just driving better because it helps you drive better? Like right? Like could we talk a little bit about driving and cannabis, please?
Well, it's always been illegal to drive high.
Okay, thank you. I'm glad to know that didn't change. Okay.
I will say that driving while, what we would call that is driving under the influence instead of driving while intoxicated, although you're still intoxicated. And, in the state of Missouri, DWI is DWI.
So wait, you're not supposed to pull up at a stop sign and the car next to you is not supposed to have smoke billowing out of it?
Right.
Oh, that's not supposed to happen.
No.
Oh, okay. Okay. I'm sorry. I'm confused.
I know. Well, and I don't think people realize how deadened their senses become when they are intoxicated with whatever they're intoxicated with. But I think a lot of people who are used to smoking or eating cannabis, depending on their favorite way of taking it in, how much they miss. It has an effect on their vision, their perception, their tactile. Everything is affected.
And you might be driving slower, but slower's not always great, right?
Well, and it's not always slower. I've seen plenty of people. And unfortunately, I think our accidents have increased because of that.
I was just going to ask if they have.
I know that Colorado had an experience with this when they first legalized many, many years ago. Fatalities started increasing. And I think we will probably, over time, start seeing more and more of that. Not just traffic accidents or DWIs, although I will admit that legally detecting alcohol versus cannabis are two totally different beasts.
Because of how the body metabolizes both of them, it's not like you can do a breathalyzer and be tested immediately on the side of the road.
Or even blood work.
Correct.
So it comes down to an officer's understanding, and there are specialized standardized tests that you can use when somebody is high rather than drunk. But it's specialized. It's something you have to get special education for.
Right. Which costs time and money and resources and all of those things, BT Dub, were not written into the constitutional amendment.
Right.
There was no extra money coming to law enforcement to help folks understand what it is, how it impacts driving, how to work with somebody who is maybe in psychosis because of cannabis, because that's really scary,
It
right?
is.
And that's a, that requires a crisis intervention officer, like a CIT trained officer, which is more time and more money and all of those sorts of things.
Well, and thankfully in St. Louis County, that is in our academy. It's already built in now.
Awesome.
So every recruit, regardless of
That
where they
is
go,
amazing.
whatever municipality they go into, or if they become a St. Louis County police officer, they have that knowledge. They have the knowledge about fentanyl too, because I train in the academy there too, and I train in the city's academy as well.
Awesome.
So they're getting that information now. So every police officer comes out having that specialized understanding of what it means to be a crisis intervention team member. What they don't understand a lot of times is how much CIT is actually a part of their everyday lives.
Exactly. That's so true.
We see so many of these recruits who are like, what do I need this for?
Like, I don't need this. Like, come on, I'm giving like parking tickets. And you're like, ha ha ha. Just wait till you give a parking ticket to somebody who is having a rough time.
Well, perfect examples. We had not very long ago a fire that was actually set by an individual. And the officer who was newly released from the academy goes, I didn't realize how quickly a fire could turn into a CIT.
Totally.
And that's just one type. It happens all the
time.
You never know. I mean, it could be a domestic. I mean, you can't separate.
Yeah, we're not
mental
talking
health
about drugs.
issues.
We're talking about all of the things that make humans human.
And do people use drugs because their lives are sunshines and rainbows?
Right.
A
Right.
lot of times they're co-occurring disorders. A lot of times they're traumatic events. You can't remove those things from they are one and the same.
Yeah, they're like this. There's no daylight. You can't talk about crisis without mental health or intervening and interdict. Like they all go together. Yeah, I mean, they all go together. You see a person walking down the side of the road and you're like, hey, that person looks like they're going to probably get hit by a car. You stop them. That could go a million different ways, including that the person, ran out of gas and is on their way to a gas station. Or it could go 14 other different ways that require specialized training and support.
Absolutely.
And it's really cool that St. Louis County has CIT for all of their officers.
Yeah, I think that, again, I think St. Louis County is a very forward-thinking community. I think
they get a bad rap, and there's always room for growth.
Absolutely. I mean, and I think that's another beautiful thing is that they understand that we're never done. We're never done.
Right.
Because the world's going to constantly change. We have to constantly change. But I think that's special, too, if you can recognize that and be willing.
Totally.
Be
That's
willing
right.
and ready to understand that that's going to happen.
Just wondering, do you have an event tonight?
Yes. So St. Louis County, St. Louis Crush not only does the Yana event every year, which is our biggest event, filling in the gaps for those who have substance use disorder or family members, friends who know somebody who has a substance use disorder. We also do walk and talks, which are very small, intimate, going out into the streets where we're the hardest hit and having conversations with anybody who will listen to us, and then giving them a free resource bag that has Narcan and safe sex kits, hygiene kits, COVID safety kits,
prevention,
and treatment and recovery information in these bags, and they're all donated, which is super cool. We have a great community. St. Louis Crush is built with so many wonderful agencies that want to see the tide change, want to see their community healthy. It's very, very exciting. So we're going out today. We're teaming up with Living with Purpose, which is one of my favorite
Shout out
coalitions.
Living with Purpose.
Yes.
I love Calvin and Kim and Duana.
I know. They're amazing.
They are great in the Baden community. I love them. They were one of our very first podcast guests.
Oh, that's awesome.
Yeah.
They're part of Grow STL.
Love it.
And they're amazing, amazing, amazing. That we've done so much great work together. So we're going out there today to have feet on the street and start talking to the Baden community. It's not the first time we've been out in Baden.
Right.
It won't be the last time. We go where the need is.
That's right.
And so these walk and talks, they're all over the place. We've been Jennings, Florissant, Delwood, Castle. I was going to say Castlewood and Castle Pines at the same time. And now my brain's gone.
It's okay.
Blank.
But then you do a lot like South Broadway too, right? Like yeah. Like Melville, Lee May area as well. Yeah.
So one of the cool things about Yana is that every year we move it.
Cool.
So the first time was North City. The second time was South County.
Love it.
Third time was North County. We were in Ferguson this year on 4/20/2024. And next year, 4/19/2025, we will be in South City.
Love that.
Yeah. So we're trucking along. We're very excited. We get great response. Last year, or this year technically, we served about 150 to 200 people. It's hard to between the volunteers and the community members. Our very first one, though, we had almost 450.
Whoa.
But it was because we were in tandem with Living with Purpose, and they have such a great reputation. And they're so tremendous,
trusted people.
They're so amazing. Kim is just the leader everybody needs in their life.
Mm-hmm. I know.
She's so amazing. But every year we've grown it. We added this year to many, many things, and we did it with all the help of the Empowerment Center.
Love that.
And that's where it was, so it was an iconic place to be in St. Louis that, really needs acknowledgement, resources, and to say we've not forgotten you.
Right.
You mean something to us. You matter.
You are not alone.
You are not alone. And we every year have gotten our food. We serve a meal while we're there for free. And this year, the new Sugar Fire on Florissant was our donators, and it is the first all-woman-owned franchise of Sugar Fire, and they are amazing. So go and try them out.
Go and eat there.
Yes,
speaking of amazing, you're pretty damn amazing yourself.
Well, thank you.
Please tell everybody at Living with Purpose I said hello.
I will, for sure.
April 19th, the next You Are Not Alone event.
Yep.
Okay, awesome. Thank you for being here. Thank you
Absolutely.
for digging in. I feel like you need to come back because I think we have a lot more topics to talk about. Thank you so much for the work that you do.
Thank you for inviting us. We love to get the word out there, get the knowledge out there.
That's right.
It's important.
That's right. Thank you.
Thank you.
If you liked what you heard, please consider rating, reviewing, and subscribing. Go to the In the Weeds page of the website. Ask those questions. That's why Melody is here, because I heard from you saying, driving while high. That was the question. So you heard from Melody that it's not really okay to do. Okay.
It's actually illegal.
It's actually illegal. Okay. So anyway, keep those questions coming. Thank you so much. Thanks, Melody.
Yeah. Thank you.
Thanks for joining us at The Preventable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at prevented.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The Preventable.